Hello everyone, welcome to Basic TCM, presented by Lamp AccuWellness Foundation Inc. Our topic for this episode is contradiction and interconsumption. Contradiction, yang excess. Example 1. If the yang increases for any reason, a healthy yin will not accept this without opposition. The yin would increase as well, thus causing a temporary state of excess in both energies, causing fluid and heat. This yin is released by the body in order to cool or control the heat. Example, sweating from heat, vomiting and diarrhea in gastroenteritis, excessive mucus in bronchitis, edema or effusions in joint inflammations. So treatment here would be, it is sufficient to sedate the yang only. One could also support the yin. Even in this case where the yin is in excess, it is possible to support it so that the yin would not be consumed by the excess yang. It is possible to increase and decrease energies with acupuncture. There are points on the meridians and therapy techniques for tonification or increasing energy, and for sedation or decreasing energy. It is also possible to influence only the yang or only the yin. In this case, the treatment will be to reduce only the yang, as this is the cause of the disease. The increase of yin in this example is only a reaction to the yang increase. If the yang is reduced, the yin or the dampness should go down automatically. Yin excess, example 2, still contradiction. If the yin increases for any reason, the yang will react to this by rising up to oppose and control the yin, thus causing again a damp heat situation. This is heat caused because of dampness. Examples for this would be inflamed acne, varicose eczema, itching and bleeding psoriasis, recurrent symptoms of gastritis in an obese person. These are situations where the yin is excess or there is stagnation of thick fluids, blood, such as in oily skin, edema in legs because of varicose veins or circulation problems, obesity, and thick raised skin in psoriasis. These are conditions where there is more substance and retention of fluid with poor circulation, and where the stagnant dampness can generate heat. Dampness causes stagnation and pathogenic heat. Treatment: sedate yin only, support the functional qi, no moxa, but use bakshu points. Lu connecting point of the yang organ, local cupping therapy. Where the heat is severe, some blood may be let. Now let's go to interconsumption. Example 1, yang consumes the yin. This is a deficiency of yin caused by exposure to yang factors over a period of time. These yang factors could be stress, exposure to excessive climatic heat or fever, excessive alcohol consumption. The body has to supply the yin from the interior in order to control the excess yang. After a point, it is only natural that the yin will be exhausted, manifesting symptoms such as loss of fluid, loss of weight, malnutrition, or reduction of substance or structure. Clinically, this shows symptoms of dryness, weakness, exhaustion or burnout, loss of weight, and poor endurance. Treatment: tonify yin, sedate the yang. This is a subacute state where the yang pathogenic factor has made a lasting damage to the yin of the body. This is caused by a substantially strong yang or a longer period of disease. For example, high fever, a prolonged and regular consumption of alcohol. We do not want to create the impression that one can achieve all balance through needling only. Yin deficiency means that much fluids, nutrition, and sleep are needed to improve this lack. And unfortunately, these cannot be substituted by anything else. The tonification with needles, however, will help the body with the absorption and distribution of nutrients and fluids. We can also improve appetite, digestion, thirst, and quality of sleep with acupuncture. Example 2, Yang consumes Yin. Blood not only circulates the nutrients throughout the body, it also circulates heat. If blood does not reach our fingertips, they would remain cold. But when there is too much heat in any part of the body, and there is insufficient fluid to cool this heat, the simplest way to reduce the heat is by dispersing it to the outside. This is done very quickly and effectively by the body by bleeding. Examples to illustrate this are nosebleeds, coughing blood in tuberculosis, vomiting blood in stomach ulcer, excessive bleeding, not clotty, in menstruation, hemorrhoidal bleeding. Treatment: sedation of yang and tonification of yin in the large intestine, balance the fluids and salts with infusions if necessary. Excessive spontaneous bleeding shows two problems. There is too much heat, there is insufficient fluid. As long as the body has enough fluid, it will react with fluid, not blood. Still on interconsumption, we now go to example 3. Yang consumes yin. So here, alcohol increases liver yang. Initially, liver yin can increase, so there will be a hangover. In due course, liver yin is consumed, causing symptoms of contractures of muscles and tendons, tremor, dry eyes, lack of control over anger. Deficient liver yin cannot control the rising liver yang. Liver yin stores blood, and when yin is deficient, there could be spontaneous and excessive bleeding, as in the case of liver cirrhosis. A reduced state of blood and qi at the end of bleeding. Treatment: sedate liver yang and tonify liver yin. Points to hold the blood within vessels, and other points against alcohol abuse. Example 4, still under interconsumption, yin consumes yang. Firstly, cold or damp exposure over a period of time. So initially, the yin increases. Secondly, the yang rises, causing symptoms of inflammation or fever. This would be the pathogenic yang. Thirdly, the functional qi or the good yang is consumed. Cold and damp exposure consumes warmth and inhibits the functional yang, the qi. So we have here the harmful heat, which is the inflammation, and this is the good one, the good functional yang, the qi. In the case of an inflammation, the pathogenic heat remains high. This is slowing of functional yang or qi deficiency caused by long-term cold or damp exposure. Treatment: tonify functional yang or qi by using bakshu and lu connecting points, sedate yin. If the heat or inflammatory symptoms do not disappear, add bloodletting or electrostimulation locally in order to either eliminate or disperse the heat. Still on interconsumption, we now go to example 5. Yin consumes the yang. Cold increases yin. Then the yang increases, causing fever, arthritis, backache, ear infection, pyelonephritis, cystitis. There is a definite history of exposure to cold, and the patient continues to feel very cold even with the fever. So this is inflammation, yang pain, fever, and this is the reduced functional qi. The functional qi goes down while the infection, the pathogenic yang, is still present. Symptoms of qi deficiency are stiff joints, poor flexibility of the back, loss of hearing, water retention, or incontinence. A continued state of inflammation will inhibit the normal functional qi. It is always the healthy yin and yang that are consumed, not the pathogenic energies. Treatment: urinary bladder 23, which is the Bakshuk point of the kidney, which activates function. Urinary bladder 58, loop connecting point of the urinary bladder. The patient should be advised to keep warm, although no moxa should be used. Bleeding cup to eliminate pathogenic heat. Electrostimulation to disperse heat can be used in local areas only if necessary. Thank you very much for your attention and hope to see you on our next videos.